Hello, my name is Elizabeth, and today I will be discussing adverse drug reactions. This presentation was created by myself as well as Richard and Zhao. The first thing we are going to discuss today is what is an adverse drug reaction. So an adverse drug reaction, or ADR, is any unwanted or harmful reactions that a patient experiences after the administration of a single drug or a combination of multiple drugs. Some at-risk patient populations we need to be aware of would be elderly patients or patients over 60 years old, women, young children between the ages of 1 to 4 years old, or patients who are taking multiple medications at the same time. So there are two primary types of adverse drug reactions. The first type would be a mild type of adverse drug reaction, and some symptoms you would see in patients would be drowsiness, fatigue, nausea, vomiting, itching, rashes. The thing to remember with this type of reaction, though, is that it does disappear after discontinuation of the specific medication. Severe types of adverse drug reactions, on the other hand, include respiratory depression, neutropenia, hepatocellular injury, hemorrhage, or symptoms of anaphylactic shock. These type of reactions do not disappear immediately after discontinuing the drug and can last for a very long time. So there are multiple causes for adverse drug reactions, and I'm going to go over just the most common ones at this time. So type A drug reactions occur as the primary pharmacological effect or a medication that has a low therapeutic drug index. These reactions are usually predictable, they're dose-related, they're usually mild, and the thing to remember, about 80% of all drug reactions that patients experience are these type of reactions. Type B reactions occur rarely and are very unpredictable, and their cause tends to be unknown. We have no idea what causes them. Less common causes of adverse drug reactions include type C reactions, which are just continuing. They never go away, and they stay with patients as long as the patient is continuing to take that specific medication. And these type of medications are usually mild in nature and usually tolerable by patients as well. Type D reactions occur or are caused after are caused from using medications long term, and they have a delayed response within patients. And type E adverse drug reactions are caused after discontinuing a medication. For example, withdrawal symptoms would fit within a type E reaction. So how do we prevent adverse drug reactions? One of the ways that we can prevent them is the implementation of software programs and facility-wide systems that prompt specific warnings for potential adverse drug reactions within patients. Some of the warnings that should pop up or should be prompted would include a patient's age, their weight or BMI, any underlying medical conditions they may have, and of course the patient's renal function, specifically if they have impaired renal function. In order to help prevent adverse drug reactions, we need to remember when either we are prescribing them or administering them that first of all, any medication can cause an adverse drug reaction. And sometimes the risks of patients getting or having an adverse drug reaction can be avoided or could not be avoided. We need to remember, especially in patients taking multiple medications at once, that drug interactions do occur and can cause an adverse drug reaction within patients. And then we need to really be on top of whether or not the medication we are prescribing or administering, is it inappropriate for that patient at that particular time? And is it unnecessary? Are there other medications we give, or does that patient really need that medication at this time? Of course, it's always important to stay up to date on the latest research and knowledge regarding specific disease processes and specific medications as well. And we also need to ensure that we always maintain a careful and responsible attitude when prescribing and administering medications. So how do we monitor for adverse drug reactions? So their monitoring for these types of reactions have three different components. One of them is being proactive, another one is targeted observation analysis, and then also in taking action to help prevent and observe for adverse drug reactions. One of the key things that we can do is therapeutic drug monitoring, which is the monitoring of specific drug concentrations within a patient's system in order to achieve the highest benefit and in order to also avoid the greatest amount of harm. So in order to do this, though, it is both the responsibility of the healthcare provider and patients themselves to monitor the progression of their specific disease or diseases. That way, providers and patients can adjust treatment plans accordingly, which would include adjusting the dosages and perhaps even the medications themselves, which would inadvertently help reduce the risk of patients acquiring adverse drug reactions. So now that we have been monitoring for adverse drug reactions, how do we manage an adverse drug reaction once a patient has had one? So first of all, if that reaction is mild, and if the medication they're taking is medically necessary, then we're going to go ahead and just continue that drug and continue to observe and monitor that patient closely. Now, if that reaction becomes life-threatening, or if a patient has a severe adverse drug reaction in general, or they just cannot tolerate that type of reaction, we're going to discontinue that drug immediately and see if we can start them on something else. We're going to administer the appropriate medical treatment to treat the specific adverse drug reactions that the patient is experiencing, which include supportive or palliative care if needed. So now we're going to just go over a quick case study regarding gabapentin. So let's set up our patient here. So Mr. Smith is a 62-year-old male that's presenting our clinic today that's been having chronic sciatic pain for about the last 6 months. He's been reporting his pain as a 7 out of 10, and he's been having trouble sleeping because of that pain. He's tried ibuprofen, he's tried baclofen, and hasn't had any relief or any benefit from either of those. And then although we referred him to physical therapy at his last visit with us, he has yet to schedule an appointment. He's also refusing to take any type of opioid medications. So, looking through my list of medications and seeing what was best for my patient, I've decided to go ahead and initiate gabapentin as an off-label use for the specific patient's neuropathic pain. So first of all, let's go through his medical history, the medications he's taking, and his vital signs. So it looks like he has hypertension, hyperlipidemia, type 2 diabetes, and osteoarthritis in his left knee. He's currently taking losartan, atorvastatin, aspirin, metformin, and now he'll be taking gabapentin along with those medications. And it looks like overall his vitals seem to be pretty stable. So what are the most common side effects of gabapentin? The most common side effects relating to gabapentin are dizziness, drowsiness, fatigue, and ataxia. So what are some ways that we can minimize these adverse drug reactions of gabapentin within this patient? The first way we can minimize it is to slowly titrate the frequency and dosage. For example, first of all, we're going to start him off on gabapentin 400 milligrams just at bedtime for about a week. And then we're going to increase that one dose of gabapentin to 2 doses of 400 milligrams of gabapentin, but he's going to take 1 in the morning and 1 at night. And then after another 7 days has passed, we're going to increase his dose of gabapentin to 300 milligrams 3 times daily. So, in order to help minimize the effect of gabapentin for this patient, we're going to start it at night, which would allow him to adjust in the medication and its side effects, especially the fatigue that he can experience. And then what are some alternate interventions? Does this patient really need to be on gabapentin? Well, once again, we can refer him to physical therapy so that we can increase his core strength and also the pain kind of in his legs and in his back. We can discuss the importance of him keeping and maintaining his appointments. That way, if he does get better, we can adjust his medical treatment. We can also discuss the reasons why he did not schedule an appointment to see the physical therapist initially. And if he has transportation issues, financial, whatever they may be, that way we can help him get to that physical therapy to maybe help him get off gabapentin. Okay, so now that we've gone through our case study, the only thing I have left is our references. I appreciate you guys listening to our presentation today. I hope you enjoyed it, and I hope you enjoy our discussion for this week as well.